Hey guys, welcome to the Neonatal Intensive Care Unit at Womack.
So we are here to give you like a brief virtual NICU tour. This is kind of a general setup you might see if your baby was admitted to the NICU. This is just some standard equipment you might see. When all of our babies are admitted, we do make sure to bring dad over for the admission process if he's able to come, just so that one parent is always with the baby if they would like to be. So the Womack NICU, we have 8 beds that we are fully capable of taking. We can flex up to 12 if the staff is allowing that. We care for any baby 28 weeks and up, sometimes maybe earlier depending on the size and the respiratory needs of that infant, but we're going to go, usually it's 28 weeks and up that we care for.
When dad comes over for the admission process, we also kind of we welcome to the NICU and run through our little rules and regulations that we have as far as visitation. And for that, we're open from 6:30 to 7:30 a.m. and p.m. We only ask parents to leave for 1 hour morning and night for shift change for privacy for our other patients.
Here's like an example of a lot of the common equipment you would see if your baby was to be admitted. This baby here has an IV in one hand. She also has a line in her belly button that also delivers fluids if needed. Your baby could have one, both, or neither. But all of our babies will have these little cords on their chest to monitor vital signs, a light on their foot to monitor oxygen, and a blood pressure cuff on their leg. Depending on what exactly your baby might need, there's different modes of oxygen delivery we can give. This baby is on a CPAP setup. We also have nasal cannulas. Some babies don't need anything. And most of our babies, when they first come over, will have a feeding tube of some sort. This one has one in her mouth. They can go in the mouth or the nose. The mouth is the most common at the admission process, and eventually we'll change over to the nose. Length of stay, we usually tell you guys, estimate your due date. Some babies go home earlier than that, but generally we just say estimate your due date so that your hopes don't get up, and most likely your baby will go home a week or two before that date.
We're very breast friendly. We have Lactation Consultants that are IBCLCs available that can help you establish pumping, breastfeeding for preemies if you're having any feeding difficulties. We also have OTPT that can help if they're having difficulties eating by mouth. But with that, we have donor breast milk that can kind of bridge the gap while you are establishing your supply. So we use the donor breast milk until you have breast milk of your own that we can use for feedings. But any milk that you do get, we do provide oral care and give it to the baby with a passy and help them start to be interested and learn the smell and the taste of your breast milk.
And that kind of wraps up the NICU gist of what we do here. That's our equipment. That's kind of the things you can expect. Hopefully we don't have to see you, but if we do, we are very well equipped to take care of your little ones. And we enjoy working with all of our families. Bye.